Good morning, everybody. Thank you for being here and welcome. Today, we're going to learn about dental hygienist career. And we have Sarah Hill. She's the lead instructor at Portland Community College for dental hygiene restorative. But before we learn what are the careers as the dental hygienist and what path you need to take, let's do a little housekeeping. So make sure you check in. That's for your teacher to know that you are here and present. And we have some great questions document. And most important thing is the evaluation form. That's how we can grade you for your participation. And that is a requirements for you to graduate. And so make sure you are muted. And if you want, you can actually turn on your camera and you're not going to be showing on the recording. It's nice to see who's out there. Here you go. Hi, Heather. And so let's have Sarah do the share.
Okay. Well, welcome everybody. Thanks for having me. I appreciate the time to teach you a little bit about what I love to do. Let me just get I have two screens here and things sometimes move in ways I don't anticipate them to. So let me get that moved. There we go. Alrighty. So as she mentioned, I'm here to talk to you about the profession of dental hygiene. I am a full-time faculty member at Portland Community College. And a little bit about me, aside from being a teacher. Sorry for just one second. We have a big office here. So aside from me being a teacher, I'm a mom and a wife. So that's a picture of my husband, Curtis, and our 3-year-old son now, D'Angelo. And then I do still see patients 1 day a week.
Sarah, we did not see the your photos.
Oh, what do you see?
Definition of extra intraoral lesions.
Oh, that's so funny. That was what I was working on. Okay, let's try that again. Thank you. You're like, what is happening? Okay, I think it's because I moved it. I'll just be looking to the side, so you'll have to pardon that then. Let's try that again. So do you see it says overview?
Yes.
Okay, well let me go back one, hopefully here. Oh, come on, take me back. Oh my. Alrighty, let's start that from the beginning. Okay, there's the pictures. So that's my husband, Curtis, and my son, D'Angelo, who's now 3. He just turned 3 a couple weeks ago. And then that's a picture of me at my office. So that's what I look like when I see patients on Wednesdays. That's the other hygienist at my office and our fun little N95s that we have there. So kind of what we're talking about today is, what are we? What do we do? Where do we work? What are the benefits and the drawbacks of becoming a dental hygienist? Of course, the question everybody wants to know is, how much do we make? And then what's it like to go to dental hygiene school? What about COVID, right? I mean, we've been hearing lots of things about healthcare and especially dental healthcare during the pandemic. And then I think we might try a little skill, and we'll talk a little bit about the program here at the school. So first of all, what is a dental hygienist? Well, first and foremost, we're a licensed oral health care professional. In many instances, we're actually considered a primary healthcare professional. We're focused on preventing and treating disease. And we work closely with the dentist to help treat oral diseases, but we also work with other healthcare professionals as well. In order to become a dental hygienist, you have to graduate from an accredited program. And the Professional Association over Dentistry, which is the American Dental Association, I'm sure y'all have heard of them at some point or seen their logo somewhere. They designate schools that have programs that meet the standards to become this type of professional. So once you've gone through a schooling program, then you have to take board exams. So we take exams that demonstrate our competency and our skills and our knowledge base in order to be a dental hygienist. After that, then you can get your license in whatever state it is that you're choosing to practice in. And then we're held to standards based on being a licensed oral healthcare professional. We have rules and laws that we're governed by and that we have to abide by. We have requirements to keep and maintain our licenses. So it's more than just coming in and getting your teeth cleaned. We do lots of things. So I thought we'd take a second and let's listen to what the ADA has to say. And now I'm wondering if it's sharing sound. Let me know, please, if the sound isn't working this time, because I had to reshare. Can you hear any music? Okay, great. So this is from the ADA and what they say a dental hygienist is.
An essential member of your dental team is the dental hygienist. Dental hygienists are highly skilled people who provide patients with long-term oral health care. Dental hygienists assess patients' current oral care and review their health history. They provide patients with information on maintaining good oral health, such as nutrition counseling and correct brushing and flossing techniques. Other responsibilities may include performing an oral cancer screening, removing calculus, plaque, and stains from teeth, applying sealants and fluoride, and taking and developing x-rays. With a combination of clinical and interpersonal skills, a dental hygienist is a valuable part of your dental team. For the Mouth Healthy Moment, I'm
You're muted.
I'm trying. Clearly, it's been a few weeks since I've had to do a Zoom meeting. So thanks for your patience with me. So I found this another awesome video that kind of talks a little bit about the breakdown of being a dental hygienist and some of basically that it's a great job to have. So let's listen to a little bit of that.
Yo guys, keeping your mouth healthy is very important. Check out this video of my friend Helen. She's an amazing dental hygienist.
My name is Helen Akopian. I'm a registered dental hygienist at Livewell Dentistry. The traditional pathway is to graduate dental hygiene school, pass all of your boards, and entering private practice. The degree required is an associate in science and dental hygiene. To keep your license active, you have to take 25 units of continuing education courses every 2 years. My day-to-day tasks consist of updating my patient's medical health history, checking for gum disease, doing the actual cleaning, x-rays, and having a doctor examine my report. You can essentially do dental hygiene in any part of the world. There's a high demand. Everybody needs their teeth cleaned. You have to have compassion. A lot of our patients come in with fear. A very important part of our job is to make sure that our patients feel safe and comfortable. One of the most rewarding parts of my job is seeing improvement in my patient's health. It's very important to make sure that our patients know what your oral health has to do with your overall health. Advice to those who want to enter the field, just know that school is going to be very rigorous. They want to train the best dental hygienists to get out there. So just stick through it, and I promise it will be rewarding.
It's a really awesome job. Click the link below to find out.
Okay, so some great fun facts about being a dental hygienist there. You can be a dental hygienist. That's one of the reasons that I chose the profession is I could go anywhere and there's teeth to clean. There are some exceptions when you go in different places around the world where they do and don't have the profession of dental hygiene established, but there are a lot of countries that do. So Europe has a lot of places you could go. Anyway, there's lots of portability to the job, so it's not limited to one area, which is great.
Yo guys, keeping your mouth healthy is very important.
There we go. Okay, so what do we do? There are lots of things that we do in that usually about 60 minutes that we see a patient. So we're looking at their oral health and we're evaluating the status of that oral health. So how do their gums look? Do they have plaque? Do they have any presence of disease? Do we have anything we could help them do to make their mouth healthier? We take x-rays, we do teeth cleanings. We actually do non-surgical treatments of gum disease. Most of you know it as gum disease. We call it periodontal disease. We can do things to prevent cavities. We can give injections to get patients numb. We do nitrous oxide, which is most of you probably know as laughing gas. Hygienists in some states can place fillings. So that's here in Oregon. We can do that as well. Lots and lots of education. A lot of what we do is we like to call ourselves preventive specialists. So we're there to teach our patients how they can best prevent oral diseases. And we're a co-therapist, which means we work alongside the dentist to meet our patients' oral health needs. We help identify needs that the dentist needs to address. And we work alongside the dentist as part of a team to care for our patients' teeth. And we do so many more things. We can work in lots of different settings and in different areas, which we'll talk about, but this is just kind of the short list, if you will. So of course, as with anything, there's some positive and some negatives. So I thought it'd be fun to kind of take a minute and listen to the bright side, but maybe some of the drawbacks, because I think these are some very practical things that if you're considering this career, you should consider.
I'm finally doing this. Hello everyone, my name is Whitney and I'm a dental hygienist. I've been a dental hygienist for about 5 years now and I've been making videos here on YouTube for about the same amount of time. If you're new here, welcome. If you've been here before, welcome back. Let's finally talk about the pros and the cons of working as a dental hygienist. I keep emphasizing the finally because this has been a highly requested video that I've been avoiding. I don't like ever putting any kind of negative things out there, you know, the con part of this video, the cons. So please keep that in mind while watching this video. I do not mean to be negative while talking about the cons of this career, because every job has pros and cons. I just don't want to see a bunch of people bashing the field of dental hygiene in the comments below because the career didn't happen to align with their personal life, you know? Not everyone is going to love the same things. That's what makes us human. And having said that, for those of us who do love the job of being a dental hygienist, I just want to make sure that everyone knows it's okay to admit that there may be parts of the job that you aren't 100% loving. There's always pros and cons to everything. So here we go. Let's start with the pros because positive equals life. The pros of dental hygiene. Pro, helping people every day. Not every job gets to say that. We truly are helping keep patients' mouths healthy and improving their health and maintaining their health, which affects their overall health. Pro, good pay. In general, the average hourly pay is pretty stable. Certain areas and locations, depending on where you live, are better than others, but regardless, we really worked hard in school to be offered a pretty solid hourly pay. Pro, freedom. In many offices, you kind of might feel freedom to the job of clocking in, doing your thing, and clocking out. I'm not saying you aren't part of a dental team because you very much are, but what I mean is most hygienists won't have their boss like breathing over their shoulder all day. You usually only see your boss when you are doing exams or you need to talk about treatment planning. And if you have your own operatory, it's kind of cool to have your own space and to do your work freely. Pro, you literally do not bring your work home. Tried to say that like period between each word. You literally don't bring your work home. And you cannot bring your work home, right? I know so many people in different industries that bring their laptops home to finish up their work in the evenings. But for us, we are definitely not bringing our patients home with us. Pro, you have the choice to work in a big corporate office or a small private practice office. Both of these are completely different vibes, so that's something cool to be aware of. If you don't love one type of office, you have the opportunity to try another type of office. Pro, another pro is that dental hygiene is a super nice job for temp work. So if you don't plan to commit to one office, there are multiple temp agencies out there where you can cover maternity leaves and other random days at different offices in your area. Pro, on that same note, dental hygiene offers part-time, and it's super normal to be a part-time hygienist. This makes it convenient if you're a parent who needs that flexibility, or if you're someone who prefers to work at 2 different offices to keep things fresh, or maybe you have another part-time job that you love and you can't choose between your dental hygiene career and your non-dental hygiene career. You can do both. It's super flexible and convenient to have this normalized part-time option. Pro, dental hygiene has multiple degree options and higher education opportunities. The bachelor's degree, for example, in dental hygiene is a great choice if you're looking into different career options within the field of dentistry, such as sales, research, education, and more. There is also a master's degree in dental hygiene as well. I actually have a video all about the different degrees and career options for dental hygienists, which I will link that video in the bottom bar below if you want to learn more. Now let's talk about the cons of dental hygiene. Con, although we just said part-time can be considered a pro, it can also be considered a con if you're looking for a job with full-time vacation and benefits and you can't find it. Dental hygiene full-time salary jobs do exist, but sometimes depending on the area and location that you live in, you just really have to find the right one because lots of times they are offered through corporate offices. So if you're someone not looking for a corporate job, it might be a little harder to find in private practice. I know someone is probably going to comment that they have the perfect private practice full-time job with benefits, which is great. Again, I'm not saying it's impossible to find. I'm just saying that they are usually less widely available than the part-time dental hygiene jobs. Con, exposure to hazards. We all know that blood and saliva can contain disease-causing germs. But if you follow proper infection control and trust the office you're working in, this should not be a con, but more of a precaution. Con, it's hard to call off work. Again, not in every case, but in a lot of cases, it's not easy to just call in sick the morning of, or even the night before. Can you call in? Of course, but it's It's stressful because you have a whole schedule of patients waiting for you. And what are they supposed to do with your schedule if they can't find a temp? Call everyone to reschedule, but for when will you feel better? Generally, dental offices are jam-packed and it's not easy to schedule a full day of patients. So not only is it super stressful if you want to take a day off and you need to find someone to cover you in advance, but it's super stressful if you're sick and you have to call your office and tell them that you can't come in. Maybe this isn't a con for some people because maybe some people don't care, but I just care so much and I'm always stressed about that. Con. This one kind of goes along with saying that you cannot bring your work home that we said in our pros, but in this sense, a clinical hygienist cannot work from home. That's not an option. I thought a lot about this during the shutdown in April 2020. Everyone's working from home and here we are trying to invent something to virtually clean people's teeth. It's just not a thing yet. Con. Monotony. I've heard a lot of dental assistants saying they would never go into dental hygiene because it's monotonous. It's the same thing over and over. However, I beg to disagree, or maybe I'm just someone who enjoys monotony. But I truly don't feel like I'm repeating the same thing over and over because one, there are different types of cleanings and job requirements that we do throughout the day. And two, even within the same adult prophy cleaning, every mouth is different. You will always find something new and something that surprises you about someone's mouth or someone's teeth. And I'm constantly learning about all the extra things we can do as hygienists, such as screening for sleep apnea, discussing nutrition, smoking cessation, and keeping up with all the latest advances in technology and research. So I love it. But again, everyone is different. I've heard it's monotonous according to some people, but I just don't feel it. Con. Body breakdown. Sometimes hygienists will have back problems, neck problems, hand problems, wrist problems, body problems. So it's super important to practice good ergonomics while you practice in office and take care of your body outside of work to avoid these issues. But if breakdown of your body is unavoidable, this is a big con for clinical hygienists. Con. State licensure transfers. So once you become licensed nationally, you have to become licensed in the state in which you plan to work. So if you plan to move later on and want to work in a state that you weren't originally licensed in, it's just not always the easiest process. I've actually heard it's quite a headache. You have to sometimes retake your boards in certain states and get re-licensed. Again, each state is different, but it's definitely something to keep in the back of your mind if you ever plan to move to a different state. So that's my video, pros and cons of working as a dental hygienist. I'm sure there are many more I didn't cover, so feel free to comment those in the. I'm finally doing this.
She brought up a lot of really good points on both sides, for some positives and maybe some drawbacks, just some things to consider. One of the things I did want to mention is that the field of dentistry for both dental assistants and dental hygienists is really in demand right now, especially in our area. There is a significant shortage. We just cannot find people to work when we need them to. So there are lots of jobs out there. There are people looking for hygienists like crazy right now. Because of that as well, the salary has actually gone up. Earlier this year, I would have said probably the hourly was around $40 to $42 an hour. That hourly wage has now gone up to about $44 to $45 an hour just since the beginning of the year, because there's such a demand for hygienists. People are paying more, trying to entice people to take jobs because they just need people to work. So if you come into dental hygiene, this is a great time to do it because salaries haven't been this high starting ever, really. So anyway, annually on average, the national average throughout the United States is about $75,000 a year. You can make more than that or less than that, depending on the region you're in, how many hours you work, whether you're in a group practice, private practice, those types of things. And the benefits do vary. That's one of the things she mentioned, is it can kind of depend on where you work. If you work full-time or part-time, you may have more or less benefits. I did want to speak quickly to the license transfers she mentioned, because just as of this summer, there's actually a national movement to make a shift in that, because that has been a problem with portability. And so right now they're working on national legislature to create some sort of portability of licenses, which when I say portability, that means that if I get a license here, that I could take it anywhere else. So we're working on it. I imagine it'll take a few years, but it's getting there, which is really exciting. That's a big win that we really need. All right, so where can we work as dental hygienists? So I think mostly what you've heard about so far is what we call private practice and group practices. So private practice means it's a dentist that owns their own business. And usually it's one dentist or sometimes a small group of dentists, and then they employ everyone and you work there. Private practices can vary on the types of patients they see, what kind of benefits they offer, but usually because they're considered a small business, they often don't have as much available to offer because they just don't have the financial backing of a large institution. So group practices would be a place like Kaiser Dental, Willamette Dental, Aspen Dental. Those are all group practices in the Portland metro area, and they have much more ability to provide benefits and full-time positions. Not to say there's lots of full-time positions available in private practice now too. So that's what most settings that dental hygienists work in. Now there's the education setting. That's the picture in the center. That's what I do. There are jobs in research that dental hygienists can get into that would require advanced education, but that's if you're not a people person and being around people all the time is not your thing. Being a researcher might be a great fit for you. There's community health settings. So the one with the pink and the blue gown, that looks like a school clinic to me, where they're probably doing a sealant clinic at a school. And there are hygienists that travel to different schools and that's all they do, which is pretty awesome, and providing preventive care to children that maybe don't have access otherwise. And that can happen in a lot of different settings. Schools are just one of them. WIC programs are another one. Head Start programs are another one. And then in the lower picture where you see the woman sitting in the chair and then the woman looking in her mouth. So that's probably a nursing home. Dental hygienists in the state of Oregon and a few other states can actually own their own business and work outside of traditional settings and see their own patients. And so that's an example of how you might do that. So let's take a little look into dental hygiene school. How do you become this dental hygienist we've been talking about?
My knowledge of dental hygiene begins and ends with the free toothbrush. On today's episode of The Skinny on the Job, we're going to take a closer look at what it really takes to be a dental hygienist. Becoming a dental hygienist requires an associate's degree and becoming licensed in the state you plan to work. It is a highly flexible field, and many hygienists work part-time. The low stress level of the job is also another positive that's reported. A few of the important qualities of a dental hygienist include compassion, being detail-oriented, and dexterity. The employment of dental hygienists is expected to rise by over 30% in the next 10 years. And the national median annual wage is about $70,000. I'm here with Ginny. Now, Ginny, tell us a little bit about what it takes to be a dental hygienist.
Well, one of the main things is a real interest, desire to work with people. Let's face it, you're working very closely with them inside their mouth, and
Right.
It takes a lot of attention to detail because we're looking for signs of any type of abnormalities, any signs of cancer. We're evaluating the whole body health because the mouth is a window into the whole body. Another thing it takes is really enjoying consistency, routine. You're basically doing the same thing every day when you go to work. Every 45 minutes to an hour, you have successfully cleaned somebody's teeth.
Yeah, I've always had really friendly dental hygienists, so I've always wondered if that was part of the job description, and it seems like it kind of is, right?
It is. People hate going to the dentist, and there's just a lot of fear because it is a very personal thing. There is some pain involved sometimes, and so part of putting people at ease is being able to communicate with them, talk to them.
Right, so good with people, you can have a flexible schedule, like routines, and also that attention to detail because you're dealing with, some real health stuff, right?
Yes.
Thank you so much, Ginny. Okay, let's see if I have what it takes to be a dental hygienist. Hi,
Hi, Nisa.
So before we get started, tell me a little bit about what made you decide to be a dental hygienist.
I've always been a teeth person. I even thought maybe I would go on and go to dental school and become a dentist, but after talking to my hygienist, I found out more what a hygienist does and how they impact individuals. Not only are we improving oral health, but overall health. Not to mention, a hygiene schedule is very flexible, so it allows to have family time, and family is very important to me. So that's why I chose hygiene.
And I love that you asked your hygienist. I think that's such good advice for anyone thinking about any career. Ask the people around you because they will help you figure out whether it's right for you. And so that worked for you then.
It did. It definitely did.
So what are we doing first?
We want to concentrate on infection control. We want to make sure that we put on the proper PPE, that's your personal protective equipment. This is important not only for your patient safety, but for you as a hygienist as well. So we want to put on our barrier jacket first. Then what we'll move to is your head bonnet. Then you'll have a face mask right here, and then you'll put on a face shield. And then lastly, what you'll want to do is put on your boots, and then wash your hands, and then very last thing is put on your gloves. We want to talk about instrument grasp or instrumentation, as well as your operator positioning as you as a hygienist, and also your patient positioning. All of these are very important. So first and foremost, you want to position your own self centered in the chair.
Okay.
You want it to be at a good level, not too high and not too low. So where your feet are planted firmly on the floor. Back is always straight and shoulders are back. Then next you want to look at the positioning of the patient. So you'll always want to recline the patient back.
And this is our patient
This
here?
is our
this
patient
something you guys actually
today.
practice on?
Yes, as students, this is what we're working on for a whole year before we actually even see patients.
So what else?
Okay, so instruments. We want to make sure that we're holding the instruments properly. This is going to prevent fatigue because you're mainly working with your hands all day long. You want to place the instrument very lightly in your hand, and you're going to grasp it with your index finger and your thumb.
Okay, so am I doing this correctly?
Yeah, exactly. You want a nice C shape, and you want it to where the instrument's not so tight that I could snatch it from your hand. We want you to be able to be very light, and I could just easily pull it from your hand.
Okay, so I did that right. I wasn't.
Exactly. You weren't too
hard.
tight.
Yes.
Perfectly.
Okay, good.
Okay, the next thing, your middle finger, we want to make sure that it rests on the shank of the instrument. This is this neck portion right here. The next is this middle, or the ring finger. This is your very important finger. This is what's going to rest on a tooth in the mouth, and this is the key for your whole hand. So you still want it touching all the fingers.
So, there's just so much you have to think about. It's very impressive.
It is.
So what do we do next?
Next, we're going to talk to Shelby. She's going to explain a little bit about risk assessment.
All right, sounds good.
Okay.
Hi, Isa.
Hi, Shelby.
How are you?
Good. So tell me about risk assessment.
Okay, risk assessment is very important. You're assessing your patient's need for dental treatment as well as their risk for dental disease and then any contraindications for that treatment. For instance, if someone's had a heart attack within the last 6 months, we're not going to treat them because what we do, cleaning teeth, introduces bacteria into the bloodstream, and that's called bacteremia, and we don't want that for our patients. Say if they have an allergy, we don't want to use something that they're going to have a reaction to. Latex gloves, those were very common. Now they are not so common. A lot of people were sensitive to that material that was in the gloves.
So you learn a lot about healthcare then.
Exactly.
So what made you decide to want to do this as a profession?
Dental hygiene for me has always, been in my life. My dental hygienist I met when I was 4 or so, and she was just always sparkling, has a beautiful smile, and then she just treated me like family. So I wanted to treat someone else like family, give them the treatment she gave me.
I've really noticed that in my experience in dental hygiene, meeting all of you here and talking with Jenny, that there is this sort of friendliness and kindness that goes along with this profession, and I really think that's wonderful. So I'm glad we have this training here and have people like you doing it. While I might not totally have what it takes to be a dental hygienist, I'm really glad people like Shelby and Anna do. My knowledge of dental hygiene.
So that was kind of a little bit of a look into dental hygiene school, which I think is fun. But yeah, you work with people all the time. One of the things I tell my students is you've got to get comfortable meeting strangers constantly. And not to say if you're not comfortable with that right now that you can't be, but just something to kind of think about. So what about COVID? Everybody's talking about COVID. It's still going on. It's still a problem. And one of the great things about dentistry is we have long been practicing use of personal protective equipment and what we call universal precautions. This is not new to us. Universal precautions means we treat everybody like they're sick. And if we do that, then we prevent acquiring disease and spreading disease. So this is something we've already done and we're already really good at in dentistry, especially since we work in the mouth where there's lots of bacteria and viruses present. But in light of COVID, we have increased a few things just to make sure we're beyond safe. I know there was a lot of information going out for a long time about how risky the dental profession is. We were actually dental hygienists specifically because of the equipment we use. We're listed as the highest risk profession for COVID because of generation of what's called aerosols. We've actually had more recent research that's come out in this year that tells us that we're not actually finding COVID in those aerosols that are produced in dentistry, which lines up with the fact that we haven't found any documented transmissions in dental settings across the globe. So are there risks for getting disease? Absolutely, but we are well trained in what you've heard mentioned as infection control and using specific procedures to make sure that we're keeping ourselves and our patients safe. So I thought it might be fun if we just take a second and try that basic skill that they were showing in that last video. So this is a skill that we teach very entry-level dental hygiene students, and it's critical to all of the work they do when they learn how to use instruments. It's called the modified pen grasp, and it's how you hold on to an instrument. So just grab a pen or a pencil, whatever you have handy, and you're going to form that little C by putting your index and thumb across from each other on your pencil like so. And you'll do this in your writing hand, your dominant hand. Okay, and once you've got a C, and that pencil should kind of come through your knuckle. Okay, once you have that, then your middle finger is just going to go just ahead of that index finger, like that. Okay, and then your ring finger will kind of come off to the side, and you'll hold it like that. And that, so bring your ring finger up alongside your middle finger, yep. And that is the modified pen grasp. And you'll rest your ring finger on a tooth in order to do all of the work that we need to do, those fine motor skills to actually clean teeth or to do assessments. So there you go. You just learned how to hold a dental instrument. Okay, I think we'll pass on indirect vision. That one's a little harder, but I was going to make y'all look in your phones or a mirror and try to write your name, because that's something else we have to do, is look in a mirror to do our work quite a bit. So if you want to test yourself on that sometime, that's a pretty easy one to try. So at PCC, this is our brand new dental hygiene clinic that we just moved into this year. It's been very exciting. It's very spacious. We're in the heart of downtown, right by PSU. We've got all these beautiful windows and lovely facility. This is a picture of our first year students in clinic. And these are two students working on each other, which they do often throughout the program, and having a good time doing it. So that's what our school looks like here. If you are interested in becoming a dental hygienist and coming to school at PCC, this is the contact information that you would reach out to once you're ready to start your college level classes. There's information sessions every term about the dental professions that you can attend to find out more. And I'd be happy to share this, this link with y'all too. So if you want to share it with the students. Here, there's an advising guide as well that we have, and a website for application that has lots of information. So I'll be sure to share those links. Maybe I'll see if I can throw those in the chat before we're done. Do y'all have any questions? I'm going to stop sharing so I can put those in the chat. Let's see. What high school and college courses have you found to be most applicable, important for your occupation? You know, that's hard to say. It doesn't really matter, honestly, because there's a set amount of prerequisites that you would take to enter the program. And so that's where some of those guides are going to come in handy to tell you what you really need to take. I don't think there's necessarily anything that's going to help you in high school more than another. If anything might help, it'd be like your hard science classes, like biology. because we do have we're a science-based profession, and you do take quite a bit of science classes as prerequisites. Was there ever a time where you cleaned teeth that was beyond cleanable? No. No, but sometimes there's been cases where the patients maybe have challenges that I don't have the equipment or the skills to meet, and then we send them off to a specialist. So that's part of that co-therapist I was referring to before, where we work in tandem with other healthcare professionals to meet our patients' needs. What would be some of the best opportunities for someone interested in the career? What do you mean by some of the best opportunities? Do you mean as far as like working prior to getting into school? There's lots of jobs that will hire high school students as sterilization techs, and you don't have to have any special training to do that. They'll train you on the job, and that will give you some great experience for what it looks like to work in the dental environment, what the different roles are in the dental team, and what those jobs do. So that's something that would be great. There's also like Medical Teams International has dental vans that sometimes people can volunteer to help with. And those go out into communities and help people that maybe don't have access to dentistry. So that might be something you could think about too. How many people a day do I see normally? So it depends on where you work. I'd say most private offices run 8-hour schedules. So I see 8 patients a day. I see patients on the hour. Some see 10 in those 8 hours. Some do 10-hour days and see 10 to 12. So it kind of depends on where you're at, but somewhere between 8 and 12, I would say. Soft skills that are important to learn to be ready for the job. So that's a great question. So you really are, one of the things that was mentioned is well, I said you're talking to strangers. So it's, you got to figure out how to break the ice and build trust with people that don't know you. And eventually they know you, because a lot of these people you see over and over again, but creating a place where they feel safe is really important. And whether that's just they're coming to see you for the first time, or there's someone that hasn't been to the dentist in a long time because they're afraid of coming to the dentist. And so we do some training on teaching our students how to work with patients that have dental fears and anxieties. We also teach our patients on how to work with our students, how to work with patients that have special needs to help facilitate them receiving dental health care. Well, of course, the college I recommend is PCC. I think we have a great longstanding program here. We've been here since the 70s. There are only actually a few dental hygiene programs in the state of Oregon. So there's one out in Gresham, Mount Hood. There's one out in Hillsborough, Pacific University. They're a private school though. So it's a 3-year bachelor degree program. It's significantly more than the other programs. There's OIT in Salem and in Klamath Falls. And then there's Lane Community College in Eugene, and there's us. So there's not a lot of us, but I think we've got a great school here. We've got this brand new facility here. We're going through lots of change. One of the things we've been working really hard on is that creating that safe space for both our students and our patients. We're working on introducing using pronouns with our patients and finding out what their pronouns are, their gender preferences are, so that we can really speak to our patients in a way that they feel seen. Unique stories about the job. Oh man, I've got lots of unique stories about the job. If y'all come to school here, you'll hear lots of them. But I would say, oh gosh, one of the best things I love about my job is that my patients kind of do become my family. So I work in a private office, and so I see patients every 3, 4, or 6 months, depending on what their oral health needs are. And you really get to know them. You find out, oh, hey, Barb, how was that trip to Hawaii? Or, oh, did you make that pie you told me about for Thanksgiving? Or, oh my gosh, you just got married this summer. Tell me about the wedding. And, all those fun things where you get to learn about these people beyond just their mouth. And that's one of the things I love the most. I've had patients walk into my office and fall into my arms because they just lost someone that they loved and they hadn't told anybody yet. I've had a patient come into my office because it's so hard to get appointments to see us. and he was feeling horribly sick. And after taking a good look over him and looking at his health, I sent him to the emergency room and found out his appendix had burst and he was getting septic. He almost might not have made it had he not come to see us or had I not sent him away. So there's all kinds of things happen, but it really is a wonderful profession. I think the thing that surprised me the most about becoming a dental hygienist is how much I can actually do, not only with my patients, but with my career. Teaching is amazing. I love teaching. I love giving back to my profession by helping mold the next generation of my colleagues. Really, I see my students as my peers when they're finished, and I'm helping them along their journey to get to where I am. And there's so much more than just that you can do. Volunteering is huge. There's such a need for it, and it can be so gratifying. I went on a mission trip when I was in dental hygiene school to Honduras and provided care to some children in a very rural community. And they were so grateful. It was so life-changing for me to think about the gift that I have to give others, and just by these skills I've acquired. So there's so much to do with dental hygiene, and there are so many routes and avenues you could take. Was this my first career choice? Oh man. Yes and no. I think this is the first career I really sat down long and hard and thought about and decided on, but I did the other things before being a dental hygienist. So I've done furniture sales. I've worked at a post office delivering mail. I've worked at call centers before, so I've done other things for sure. But this is definitely the first career I had. When I was in high school, I actually thought I was going to do marketing and be in business. And I didn't end up being able to go to college right out of school because my family couldn't afford it. I didn't get scholarships I'd hoped to get. And so I had a few years to figure out what I was going to do. And I kind of floated around here and there. And I didn't actually start college until most of my peers had already graduated. And that was okay. And here I am now. So all these years later, it took me several years to get through school because I had to work while I went. So I worked half time and took my prereqs half time. And then once I got into the program, I just did that full time. But yeah, there's all kinds of routes to get there. We have lots of students that have done other things prior to coming to dental hygiene school and finding new paths for their lives. And that's okay. Why did I choose it? So I choose it for a number of reasons. So for myself, I was looking for stability in a career. And one of the things I loved about dental hygiene is that there's teeth everywhere. So I could go anywhere and I could find a job probably. That's not going to change. So that was number one. Number two, I really appreciated that it was a fairly minimal education. And when I would say that, I mean, you don't have to like go get a master's degree for the amount of salary that you make. It's really impressive that most places it's just an associate's degree. That being said, it's a pretty rigorous 2-year associate's degree. You definitely earn your stripes, but it was well worth it. I mean, to be able to buy my own home and support my family and have my own car. I didn't even have a car when I went to school. I was on public transit for 10 years. I rode public transit. Being a dental hygienist has totally changed my life. So I'm thankful to it for that. But I liked also the flexibility, the fact that I could consider working part-time if I wanted to spend more time with family or not be locked down to something that I had to be working 5 days a week at. So yeah, it's got lots of options, which I really love, and lots of different ways you can do this job, which is fantastic. What other questions?
That was very insightful. And yeah, I did not know that dental hygienist makes a lot of money.
We do make good money. And that's of course based on full-time wages. So if you're working full-time, yeah, you can make a pretty good salary.
And I think if you're like someone like me who likes instant gratification, well,
all day long. It's so awesome. Every time somebody comes in my chair, they're cleaner than when they came, when they leave. It's so awesome. Instant gratification every hour.
Yep. So this is a good career for that
Totally.
kind of like, yay, it's clean.
Yes.
All
Yes, I
right.
know it's so funny because people will be like, oh my gosh, it's so bad. And I'm like, no, it's like a treasure hunt for me. This is exciting.
All right. Thank you so much.
You're welcome.
It's like every career event is where I was like, oh my gosh, I should be a dental hygienist now.
It's a great career. I've included the links that I had on my slide. I threw those in the chat for you all. So if you want to check any of those resources out, you can.
Okay. If you have any more questions, just put it on the chat. And if not, then we'll have Sarah Hill go and give her more. Are you having a class today?
My students are in clinic right now.
Oh.
They're seeing their patients.
All right. Thank you. So I'll stop the recording and
Bye. Have a great day, y'all.
yeah.